USCE is one of the most important factors that will help you secure a residency position. Now, we have a lot of information in this video, so let's get right to it. Now, USCE, or United States Clinical Experience, is one of the most important things that will help you get into residency. However, there's a lack of data online of how to apply or what the different types are. That's why I've done a lot of research and also asked a lot of people who've done their rotations and made this video for you. Before we get started, I do want to say that if you have any questions, feel free to add me on Instagram at Dr. Chala, or you can leave a comment down in the comment section down below and I'll be sure to answer your questions as soon as possible. And if you found this content helpful, please leave a like and subscribe for more videos like this. So USCE, or United States Clinical Experience, refers to hands-on or hands-off clinical experience working in a US medical environment. As I said, it can be divided into hands-on or hands-off. Hands-on mainly including your clerkships, externships, and sub-Is, and your hands-off consists of your observerships and research. Now, with all this talk about USCE, you might want to know, how does USCE benefit us? Well, first off, it helps expose you to the American healthcare system. The healthcare system varies from one country to another, and so the program director really likes to see that you've had some exposure to the entire system. It also shows that you've had exposure to American patient populations because patient demographics vary from one place to another. It gives you the opportunity to be evaluated by an American doctor and in turn get an LOR. Now, an LOR refers to a letter of recommendation, and when applying you need around 3 to 4 LORs, and 1 month of USCE gets you at least 1 LOR. Now, USCE helps expose you to the different types of electronic medical records, or EMR, and this is something that the program director would like to see because remember, familiarity with the overall system just gives you a better chance of matching. One of the most important pros of doing USCE is that it gives you a chance to network. While doing rotations, you get the opportunity to interact with different residents, fellows, and attendings. It gives you an opportunity to show them how hardworking you are, and it also could open doors for you to do research. And lastly, USCE helps you with all the small things, like learning American drug trade names or different treatment protocols. Now that we talked about the pros, let's talk about the different types of clinical rotations. The first and most important one is clerkships. Now, when you look at American medical schools, it's a 4-year program that's divided into 2 years of basic science learning, where medical students go and sit in a room and attend classes and just learn their basic sciences. And the second half is mainly clinical, where they go to the hospital and do rotations under different specialties. These rotations are referred to medical students as their clerkships. And therefore, when you as an IMG do your clerkships, it basically refers to you doing your rotations just like other medical students would. This is why doing a clerkship in your desired specialty is much more helpful because it gives you a lot more exposure. However, we will talk about this later in the video, but if it is too competitive and you can't get a clerkship in your desired rotation, getting any clerkship is better than nothing. Also remember, you must be a student to apply for clerkships. Once you're a graduate, you cannot apply for clerkships. Now, many people I know would actually finish their requirements for their medical school, wouldn't take their graduation or their degree. So they're technically considered a student, and that's when they would do their rotations. However, this isn't allowed by all colleges, and if it isn't allowed in yours, I'd suggest you to do yours before you graduate. American medical students generally get a grade at the end of their rotation, and this is their clerkship grade. You as an IMG doing your extra rotations won't be getting a grade. However, it's still important to do your best because it does give you a chance to network, and also it can be reflected in your letter of recommendation. Lastly, remember that a clerkship refers to a medical student doing their rotation in their 3rd year, whereas a sub-I refers to a person doing the rotation in the 4th year. Your responsibilities in each of this are more or less the same, but it's just different nomenclature. Next, you have your externships. Now, externships are rotations that you can do as a student. In terms of value and their LOR, they are a close second behind clerkships. However, they are valuable, and if you are a graduate, I would suggest you to go and do your externships. Now, there's a gray zone regarding what the rotation holds and your responsibilities during an externship, and this is because it can vastly vary from one rotation to another. It could be a full-blown rotation at one hospital, and it could be just an observership at another. However, at the end of the day, its main impact is on your resume and LOR. And both of these are just a close second behind clerkships, so I wouldn't hesitate to do externships. Lastly, you have your observership. Now, observerships are considered hands-off rotations, and this is because you won't directly be involved in patient care. You'll just be shadowing or following the doctor and watching him do his day-to-days. This could either be done in an inpatient setting or a clinic. Now remember, the LOR or its value on the resume isn't nearly as much as it is in a clerkship or an externship because those are hands-on and you're directly getting exposure by doing the work. Now, many people overcompensate their lack of clerkships and externships with many observerships. While observerships are still better than absolutely no rotations, I would say the threshold is around 3 to 4 rotations, where if you do more than 3 to 4 observerships, it doesn't add that much more value. Now remember, doing a hands-on rotation at a small community hospital is still better than doing an observership at a big name university. And if you do end up doing observerships at the end of the day, I would suggest that you do it at a program that has a residency program, just so you have higher chance of getting an interview later, and you may even match there for residency. Now that we talked about the pros and the different types of clinical rotations, we need to talk about how we can apply. Now, after doing a lot of research and asking many people who've done their rotations, I've gathered that they mainly apply through one of two ways, either directly through the university or through companies or portals. So let's first talk about going directly through a university. Now this essentially is the best way that you can get a clerkship. Now I've left links in the description down below of different universities that are offering rotations with and without a step 1 score. Now at the start, generally when you apply for these clerkships, you have to pay an application fee. Now the cost of the application fee can vary from one program to another, and programs generally would prefer you to send an application instead of you calling directly and see if there are any vacancies. Now the hospitals could just be saying this because the application could be a way that they can make some money, but I do know some people who have called the hospitals to see if there were any vacancies. But if you do it at your own risk, because hospitals generally don't like this. Now when you apply for residency, you generally apply in September, and therefore many people try to get their rotations in the months prior to that, anywhere from April to August, and therefore these are the most competitive months. And this is why I'd suggest you to apply at least 5 to 6 months before your desired date to ensure your spot. Now I'd say around 80% of the programs do require a step 1 score, but almost every hospital does require TOEFL, so I'd suggest you to write TOEFL as soon as you can. But remember, the validity of your TOEFL score only lasts for 2 years, so make sure you write TOEFL if you know you're going to do rotations within the next 2 years. Now what is the average price per rotation? Now coming to the start, the application fee can cost anywhere from $150 to $500. The rotation can be anywhere from being free to up to $6,000 per month. And obviously it depends on the location, but I'd average the travel, food, and accommodation at around $1,500 per month. Now for accommodation, you can use something called rotating room, and the links down in the description below. This is basically a service for medical students who are doing their rotations, and they charge around $500 per month for the stay. Now I did mention earlier that some rotations are free and the other are paid. Now what are the differences between these free and paid rotations? First off, obviously free rotations are a little bit more competitive to get into. You need to apply at least 6 months in advance, and you need at least a better step 1 score, CV, and personal statement to be accepted to rotate here. Whereas paid rotations are a little bit easier to get. And also remember that the big name universities like Harvard, Stanford, or Cornell generally are a little bit more expensive. Now a few things to keep in mind are that doing your rotations at a big name university like Harvard really doesn't make that much of a difference from doing it at a small community program. In fact, I'd suggest you to not go through these big name universities just because the LORs are a little bit more generic, whereas they're more personalized in smaller hospitals. And also these big name universities generally don't extend invites for interviews. A lot of the times you can get an interview at the place that you've done your rotation, and that's why I'd suggest that you do it at an IMG friendly program so you have a better chance of getting an interview and even matching there. Now let's talk about applying directly through portals or companies. Now this basically means that you go through a company and have them set up a rotation for you. Now there are a lot of pros and cons that come with this. Now one of the best things about this is that you don't need to wait 4 to 6 months to get your rotation, and generally you get it within 2 months. Also, most of these don't require a step 1 score, but most of these do require TOEFL, so I'd still suggest you to write that. Now while these pros are great, we're gonna have to talk about the risks that come with applying to companies and portals too. And to get to that, I need to talk about your general role when you apply through these companies. Now when you apply directly through university, it's going to be a set rotation by the medical school under their curriculum. However, when you go through these companies, they generally pair you with a doctor who's affiliated with these universities. Now because of this, there is no set curriculum and your rotation can vary from one to another. Your responsibilities will vary, but after asking many people, the average experience is generally along the lines of working hands-on with the doctor in a clinic and then going along with the doctor to the hospital and observing him over there. Now at the end of the day, it all depends on your resume and your LOR. Now on your resume, it's still considered a clerkship, so it's equally as beneficial. And on the LOR, as long as you get the university letterhead on the top of your letter, then you should be okay. But then where does the risk come into play? Well, I've heard that sometimes the companies will promise that you will get the university letterhead at the top of your LOR, but that doesn't happen. And this widely varies from one rotation to another. You can get one rotation from one company and that could be great, whereas you can get another rotation from the same company which isn't so good and you might not get the university letterhead at the LOR. Before we go further, I want to categorize the importance of LORs from different places. Now this by no means is any set rule, but this is more or less what I've gathered from asking so many people. When it comes to the order of importance of LORs, your clerkships are definitely the most important, with university hospitals being more or less equal to community hospitals. Next, you have your externship LORs, which is more or less equal to getting an LOR from a doctor who is affiliated with the university. Now, the next step would be observerships, clinics, and telerotations. And last, you have your home country. Now, I'm not really sure about where your home department chair letter falls on this. Some people say that it is important and some people say that it's not. If you have 3 to 4 LORs, all from clerkship, then those are going to be better by far. So now we need to talk about who should apply through these companies or portals. People who need quick LORs and can't wait 4 to 6 months for their clerkship should definitely go this route. Also, people applying from the months of April to August, which is most competitive and they couldn't secure any clerkship, should also go this route by applying through companies. If you're a graduate and you couldn't find any externships or you didn't do your step 1, then you can apply through these companies. Lastly, remember that going through these companies always are a little bit more expensive and you're gonna have to pay a higher price because they take a commission or a cut. Now let's talk about the different companies that offer these rotations. Now I just want to say I'm not affiliated to any of these companies and use these at your own risk. Remember, some of them may be good, some of them may be bad. And even if a company is good, you may get a bad rotation from it as well. So apply knowing these risks in mind. So the different companies that I've heard people use are Med Clerkships, Ameri Clerkships, FMG Portal, Chicago Clerkships, ASMD, AMO Opportunities, and Usmle Sarthi. Alright, so now you call the company. What are certain questions that you can ask them? First, you can ask them if the rotation's a clerkship or an externship. You want to ask what your role during this rotation will be, whether you're going to be rotating with a doctor and is he affiliated with the university. Will your LOR have a university affiliated letterhead? Does the rotation have a step 1 requirement? And how long is the rotation? An average being around 4 weeks. What the price is and if they help with accommodation. Now, not many help with finding accommodation, and if you can't, I just suggest you to use rotating room or Airbnb. And lastly, ask if there are any other medical students rotating there and if that hospital has a residency program that is IMG friendly. Lastly, let's talk about different tips and frequently asked questions about these clinical rotations. First is about university programs versus community programs. Now, definitely the best programs that you can get are university programs that are accredited with a residency program, but at the same time, I'd say community hospitals are just as important. Some people think that universities are better than the community hospitals, and that may be true to an extent in terms of exposure and the contacts that you may make, but at the end of the day, it mainly depends about your resume and your LOR, and the value of both are more or less equal on both. Next, I would suggest you to go to the program director around the 3rd week of your rotation and tell him that you're interested in the program. This will just make sure that the program director will keep you on his radar when he's selecting applicants to send out interviews. Also, make sure you go and ask for feedback. It shows the program that you're not just here to try to impress them, but you're actually willing to take feedback to become a better physician overall. So always remember to ask for feedback. Also, if you're applying directly to a university program, I'd suggest you to start doing your research a few months before you actually apply, because it takes a long time for you to try to collect the requirements. And if you want me to make a video about this and specify the different things that you need to apply for a rotation, then please leave it in the comment section down below. I get asked if observerships are USCE, and it's mainly different from place to place, but more often than not, it's not considered USCE. Now, there's no hard filter to filter out candidates who don't have USCE, but always having some clerkships or externships look better than having some observerships. There are very few programs that do consider it hands-on USCE, but that's quite rare. Now, people ask me, I don't have any USCE, will I still get interviews? As I said before, there's no hard filter that will exclude you as a candidate. However, it's always better to have them. Now, if you don't have any USCE, I'll always suggest you to do some rotations after sending in your application and emailing the program to update them that you have done your rotations. This will help you make the right contacts and help show the program that you're still working on your resume, because most people like to see that you're doing something after you submit your application. Now, the last thing I want to address is that USCE is not a requirement but a preference. There are people who have gotten interviews without having rotations. But remember, now this isn't a definitive number, but around 30 to 50% of the people applying do have rotations. So there are a significant amount of people who do have it that you're going to be competing with. It can affect the number of interviews that you do get. I personally haven't done any clerkships and externships because I didn't have this information available to me. I've done a few observerships before applying for my residency, and a friend of mine who had pretty much the same scores as I did and pretty much the same application got around 35 interviews, whereas I got a little over 25. So you can see that it definitely has affected the number of interviews I've gotten. Now, if you want me to make a video on the different requirements that you need for USCE and the things that you need to gather and collect together before starting your rotation, please comment in the comment section down below. And if you have any questions at all, feel free to message me on Instagram at Dr. Chala or leave a comment in the comment section down below, and I'll reply to you as soon as I can. And if you found this content helpful, please leave a like and subscribe so it'll help me make more videos for you.